Hello and welcome to Business Today Television. I'm Siddharth Zarabi and you're watching easynomics. A new strain of COVID-19 has emerged in India, raising fresh concerns. Identified as a descendant of the Omicron variant of SARS-CoV-2, JN.1 is the result of a highly mutated strain from the BA.2.86 variant nicknamed Pirola. The World Health Organization currently considers JN.1 to be a variant of interest. It's added that it presents a lower risk. Yet many experts believe we should be careful and cautious. So how significant is this risk? For more on the fresh surge in COVID across some places, we are joined by Dr. Rajeev Jayadevan, the co-chairman of the National IMA COVID Task Force. We're also joined by Indranil, Chief Economist at Yes Bank, and my colleague Sakshi Batra is also with us. Dr. Jayadevan, I want to come to you for a medical practitioner's view on this latest surge and how significant it is and whether in medical terms it is a risk.
That's a conditional question. Depends what perspective you're looking at. If you look at a healthy young adult's perspective, if a bout of COVID occurs, it's very unlikely that person will end up in the hospital. 1 out of 20 of them will go on to get long-term health problems, which is termed long COVID, which includes things like tiredness, breathing trouble, confusion, loss of memory, and mobility issues. So that is called long COVID. So that's a 1 in 20 chance of 5%. I'm giving you the conservative estimate. Higher estimates are also circulating. So that is the standpoint of the healthy individual. But from the standpoint of an older person, let's say over the age of 60 or 65, or somebody who has significant underlying health condition, for example, heart failure or chronic obstructive pulmonary disease, which basically means a bad lung, a bad liver, or a diseased kidney. Yes, these individuals could get destabilized from the COVID infection and require hospitalization. And some of these people may have bad outcomes. For the most part, when these people are being admitted to hospital now, they are getting better quickly and are being sent home in good condition. So that's a good part. But we do not want this variant, which is fast spreading, to go deeper and deeper into the community where more and more frail individuals might get affected. Right now, most people who are affected include those who are relatively healthy, who can travel, who are well enough to go to work, study, or otherwise. Among children, the chance that COVID will cause severe disease is actually very, very small, except if the child has very severe neurological or other underlying health conditions.
Dr. Jayadevan, in the past when we saw variants come in, there was a certain kind of impact. And this time round, one of the key facts that experts are pointing out is the level of vaccination in India. A double dose, which a vast majority of Indians have a double dose and many have had a booster dose as well. So regardless of the severity and the speed of spread, is the level of vaccination our greatest safeguard according to you?
It really is. Vaccination protects against the disease broadly along two separate lines of defense. The first is called antibodies, and the other is broadly can be called as cellular immunity or T cells. Now, the two operate separately. It's like the Army and the Navy, right? So the antibodies target certain proteins on the body and spike of the virus, and they can be fooled as the virus continuously makes changes. For instance, this JN.1 strain is markedly different from anything that circulated commonly in the past. So that is why people are watching it very carefully with substantially more interest and respect and a level of uncertainty than most recent variants that were mere mild alterations from its predecessor. The second line of defense in our immunity is called the T cells, and they cannot be fooled so easily by the virus. So in other words, the vaccination has created a broad immune memory that will protect us in the long run, regardless of the variant. So that is the currently held belief. That is the reason why, even after Omicron and its sublineages subsequently affected very large numbers of people, we did not see the horrendous outcomes that were seen in the first half of the pandemic. And a good reason for that is the immunity that was acquired by fast rollout of vaccines. And I must also mention that as there are many people who perished in the first half of the pandemic. Those who did not die in the first half of the pandemic, despite an infection, went on to develop what is called a natural immunity. In other words, natural immunity, even though it's casually mentioned, came at a heavy price of millions of people's deaths.
Okay, Dr. Jayadevan, please stay with us because I will draw you into a larger conversation regarding the impact from an economic point of view. That's what we are focused on, and that's something that I'll go to Indranil Pan also on. But before I do that, I want to bring in Sakshi. Sakshi, one of the key things that we are asking is the impact of this. In the past, and we'll try and bring that up on the screen, we saw what happened to our markets when the first wave of COVID came and what happened subsequently. In your recounting and memory, describe how the markets responded to those initial episodes of COVID.
Absolutely, Siddharth. If you see, the first time when the markets really understood the COVID-19 impact was in March of 2020, when they started to see elevated numbers of cases, and on significant days on March 6th, March 9th, March 11th, you will see there was a decline in high single digits in the Indian markets of both Sensex and Nifty. But the maximum downtake was seen on 23rd of March of 2020 when the first nationwide lockdown was announced, and there was the single biggest day decline of 13% on both the Sensex and the Nifty. And that was because there was a heightened uncertainty around COVID-19. We did not have a vaccination in place. We did not know whether there was a healthcare system to sustain or to take care of people who are getting impacted by COVID-19 by then.
Right.
There was a lockdown which nobody had anticipated before. We had never had a work from home culture. The economies were shutting down, businesses were shutting down, and all of it was getting factored in there. But subsequently, from that time, if you see till October of 2021, when we have had at least 3 waves of COVID-19, we've seen a unique one-way rally from 7,500 on the Nifty in March of 2020 to all the way up to, say, 18,600 levels in October of 2021. So investors flocked to the street. There were demat accounts that were added. At this stage, we are at 11 crore demat accounts. 35 lakh unique demat accounts were just added in that period of 1 year, which was never seen before. The kind of influx was seen. Liquidity was abundant at that point in time, and therefore, at this point in time, the markets are prepared in case also the COVID-19 cases rise from here. They have handled this before, at least 3 more times before, and which is why the markets are not very unnerved with this number.
Let's also focus on that chart for a moment. And Sakshi, very clearly, the last couple of days where we saw significant volatility, can that be ascribed to a COVID fear or was it normal profit taking at a time when markets are at a bull run like never before and people are very skittish, very nervous?
Just day before yesterday, Siddharth, when we were speaking to experts and talking about what are the 3 factors that the markets really saw a 1,000-point dip on the Sensex, one of the factors was definitely brought in as the rise in COVID-19 cases in the previous 24 hours as well. However, if you see, the markets recovered pretty quickly from that as well. So that was not just the only factor. Of course, profit booking was the biggest factor. The Nifty in the last 2 months has gone up 3,000 points. So a 500-point retracement is seen as a healthy correction at this point.
Absolutely, but the key thing, if you were looking at that 5-year chart, which is right there, tells you the story of the markets and the response. But I'm now coming to Indranil Pan. Indranil, thank you for listening into these 2 points of view. I want you to take up the broader impact that is likely if this surge were to worsen, although the doctor on the panel and elsewhere as well Everyone's saying there is no cause for worry. In fact, there is no mask mandate also that's up. And this may be just yet another variant in possibly a line of future variants.
I think to start with, I think we just hope that this is just another variant. And nobody is sort of envisaging or even looking forward to the type of lockdowns that we saw and the stress that we encountered in terms of not only the economy, but also in personal spaces at various points in time. Now, my understanding, and even after sort of hearing the doctor on the panel, I think it is a variant of close watch, no doubt. But people are still not talking about a wave, very particularly not only in India but even in the rest of the world. The rest of the world also has seen some sort of spurt in the virus and the spread of the virus, but nobody has very clearly talked about any implication in terms of a lockdown and etc. etc. Now, the good thing is that we have already fought through the virus. So we are prepared in terms of the infrastructure. That's number one. And we know what to do in terms, and that's the direction that the governments are turning us to. The greater than 60 years population has been asked to mask up, and there is a general sort of cautionary stance that is going out from the government, which is a good thing. Now, having said that, personally, I do not think that there is a lockdown fear that is coming through. First of all, I think it's too early to even call on a lockdown. And secondly, I think the government and policymakers are very clearly understanding that a lockdown is not the best thing to happen at this point in time, because the world continues to struggle through volatilities. There continues to be supply side worries. There continues to be worries on the demand side. Especially if I look at the Indian GDP, the services component of the GDP is still not up in a very significant way towards the pre-COVID level. And if we have a lockdown at this point in time, we might have a severe slowdown in the economy coming up. So broadly, I think it's too early to sort of put up red flags for the economy in terms of loss of production, loss of consumption, and therefore a significant slowdown in the economy.
Indranil, one quick follow-up, and this is to do with the broader macro data that we have been seeing on inflation and on growth, and you referred to that. Would it be fair to say that unlike in the first couple of rounds of COVID 3 years plus ago, this time all stakeholders, including our medical infrastructure system, is far more prepared, and therefore there is no cause for any of the skittish behavior that we have seen in the markets, for example?
No, so markets again, as I think Sakshi implied, that when we had the severe lockdown and people were locked up in their homes, obviously there was a sharp reduction in the consumption, and that led to a very sharp increase in the domestic flows to the equity markets, and the markets recovered pretty quickly. But the balance sheets of companies are much better today. Thanks to the first round of COVID, when we saw a lot of deleveraging that happened. So there are possibly no fears in terms of the markets immediately. But having said that, nothing is a zero probability game at this point in time. Be it the risks from the economy side, be it the risks that we are anticipating from the global front. And very critically, I think if a COVID hits and a wave hits at this point in time, in a situation where we are anyways anticipating growth slowdown in the globe, and that to have implications for the emerging markets, that could be bad. The worst part for me is that most of the governments across the world has exhausted their fiscal space because of the very high expenditures that have happened during the COVID period. Even if you look at India, the public debt as a GDP was about 65-67% in the pre-COVID phase. And because of the large amount of expenses that the government had to undertake, both on the medical front and also on the social front, the public debt GDP is currently at about 84% and doesn't sort of seem to go down to the 65, 67% in a hurry, at least not within the next 3 to 5 years. So the space within the fiscal, which was the main fighting element in the COVID period, in the last COVID cycles that we saw, is significantly eroded today. And therefore, just reduction in monetary policy interest rates may not be helpful if actually a COVID strikes. So that's something that we need to keep in mind when we look at macro implications.
Dr. Jayadevan, one follow-up question. Forget government directives. What should be ideal behavior at this point of time? Because we have also seen earlier during this year, especially in North India, and we are based out of the NCR, a weather change and the normal cold that we used to see suddenly is far more severe this time. And we have seen pneumonia also claim victims earlier during this year. What should the average individual do, perhaps starting with being masked up?
Yes, I would like to add that many people see the impact of COVID through parameters such as deaths that are reported in the media. I would say the impact of COVID on a country's economy, although I'm no economist, I'll say that the productivity angle is significantly impacted when a person is not able to go to work. That has an effect on the economy, and when 1 million people can't go to work, at least even if it's for 3 days, it has a substantial impact on the economy. So that's something that we should not discount. Frequently, I hear casual statements saying that nobody is dying, people are not dying like they did before, almost like a complaint, and that therefore COVID is not important. No, COVID is a fast-spreading virus. It can reach enormous numbers in very little time, and can incapacitate people to such an extent that can cripple the economy. So, so that is something I would like to add in this context. So, in terms of individual precautions, I always say that if each one of us can do a little bit, especially during times of increased spread of such viruses, then it will help a great deal to reduce the overall impact of this disease on society at large. For starters, we know how it spreads. It does not spread by coughing or sneezing. It spreads when people talk or when people breathe out what we call aerosols, which is basically a mist-like substance that emit out of our breathing. And it increases when people talk. So it's a weightless series of droplets. The closest equivalent is mist. We've all seen mist. You can't see it up close, but from far you can see it. But mist is made of tiny weightless droplets of fluid in which viruses are embedded, and they use these droplets to travel from person to person. So wearing a mask in such a setting, for example, a crowded, ill-ventilated indoor setting, is an effective way of reducing our own risk of infection. And also, God forbid, we have an asymptomatic infection. Say, a lot of people are carrying the virus without feeling ill. So such people might go to work. And if that person is wearing a mask, yes, they are less likely to infect the person standing or sitting next to them. So these are simple techniques. So it's not about masking the entire country. It's about using masks where it is where common sense actually indicates its use. For example, you're traveling in an elevator. The elevator stops or the lift stops at every floor in a 10-story building. Imagine it has 15 people standing inside it. It's crowded.
Right.
One of them has infection. Other people are going to get it. If you're wearing a mask, you're well protected. Likewise, you're sharing a ride in a cab with strangers. Wear a mask. It'll keep you safe. So that is the kind of individual input we can do. And secondly, stay home if you're having a fever or a cold. Please don't go and spread it around to other people. And thirdly, avoid social visits to hospitals. In India, I see this culture of people visiting hospitals to see their near and dear who are admitted. No, hospitals are not the place to make social calls. Only essential bystanders should be there in the hospital.
Two quick questions. One, is there need for a fresh round of vaccinations, and are our current vaccines, including the most widely used, enough to deal with this variant?
Vaccines protect on two fronts. India is a well-vaccinated country. The vaccines we use are different from that are used in the Western nations. So whatever data they're putting out, their recommendations need not directly apply to India. So that's the first point. Second is, as I said, vaccines protect on two fronts broadly. I'm simplifying it to the greatest degree possible. Firstly, they generate what's called antibodies. Antibodies are like missiles that latch on to certain targets and destroy them, or in immunology terms, neutralize them. So the effect of these missiles or antibodies gets blunted when the virus makes changes. For instance, the JN.1 is a vastly different variant. So many of the earlier antibodies might not be able to neutralize it, which means that the virus could still infect these people who are vaccinated. That's really why it's spreading. Secondly, the second arm of the immune response is called T cells or cellular immunity. Now, these cells work at a different level. They're not fooled so much by the changes that the virus makes every few months. So our long-term memory from these T cells is so good. And
Right.
that's one of the main reasons why Omicron, even though it infected practically everybody on the planet, did not cause nearly as much deaths as the first two waves did.
Right. Doctor, there's just this one question which a lot of people ask. ये कोविड कब खत्म होगा? Is there an end game to COVID? Because before this came up, we thought the end game is now well and truly underway, but it seems to be something that we'll have to practically live with forever.
It's a good question. See, the uniqueness about COVID, let's just keep the tragedy aside for a minute and look at the facts. It is an all-new virus that has suddenly landed on the planet. It's almost like imagine it's like an alien spaceship that landed, and we're battling them every day. So that's the way scientists look at it. So it is not something that's written in the books. So the longer time that we have to examine it, the better the quality of our predictions will be. So if you ask me this question in the first 2 months of the pandemic, I'd say I don't know at all. But now, with 4 years of experience, we know that this virus is now set into what's called a cyclical pattern, which means several months of lull followed by a surge. It's like night and day, but definitely every night will be followed by a day. India enjoyed a 7-month gap, which is unprecedented, from April up until November, of almost no COVID. I can confirm that. It's only since November that cases started popping up. So this is going to be the pattern for the foreseeable future.
Okay. Sakshi.
I wanted to understand from you what Dr. Jayadevan just pointed out, that we have had 7 months of absolutely no COVID. All of us have also forgotten to wear masks as well. But economies at large, we've been looking at how IMF and the brokerage houses have been raising their GDP targets, now looking at the fundamental qualities that economies have. But periodic coming of these COVID-19 waves, will they threaten the upside potential and the expectation on GDP? Will that also threaten the current stance of the central banks around the world?
Is that for me, Siddharth?
Yes.
Yeah. Okay. So I think we heard the doctor say that we have had an unprecedented 7 months run when we had almost forgotten about the virus, and that's reflected in the economic activity and the way things have panned out. So first quarter GDP was definitely on the higher side, which also led the Reserve Bank of India improve its GDP numbers to a 7%. Now, at this point in time, nobody is talking of a risk of an extreme lockdown, the type we saw in the first round. Yes, we need restrictions. Yes, we need a watchful eye in terms of the COVID, but nobody is talking of a lockdown, which definitely therefore means that the production process can continue. And if people are not locked inside, the consumption process can continue. So that, I think, is the most crucial bit. You did ask about the central banks. I think central banking is possibly more directed towards the inflation perspectives. Now, here we can have a bit of a dichotomous situation whereby we already have relatively higher inflation. And if there is a lockdown and it affects the supply chains, then there's a risk of an even higher inflation. And we also have noted that supply chains, even in the food arena, has also been affected due to weather conditions. So it will be a dichotomous situation, or a very tricky situation for the central bank of any country, whereby they see COVID hurting their social infrastructure and bringing down growth. And on the other side, if supply side issues crop up once again, which sort of elevates the inflation levels as we had seen during the lockdown period of the COVID. So I think it's a sort of a thin ice sort of walk for central banks at this point in time. But taking you back, I think what remains relevant for me is that the fighting power for the economy, which had happened more through the fiscal side, is severely restricted at this point in time, and that I think is the crucial worry for policymakers.
Absolutely, and that's a very good look ahead as far as the economic consequences are concerned. Viewers, Dr. Jayadevan, and if I try and put his advice into my own words, there is no need for fear, there is no need for panic. You have to be cautious, you have to maintain hygiene. That is now something that should be inbuilt in all of us, and we are far more prepared medically than we were in the first couple of rounds, and that's why we should be more sanguine about the likely impact. It's not very clear as to how much this will impact, but it is perhaps early days yet. We have had a good 7-month period where there was practically no COVID. And the summation on the economic side, government balance sheets, which took on much of the fight to restore economies across the world post-COVID, post the lockdowns, those balance sheets have been very, very severely stretched, and we don't know how much capacity they would bear. And certainly as far as the Aam Aadmi, the common man is concerned, inflation is something that he or she won't want. They can live with a severe cold, but more mehengai is something that most Indians will not be able to tolerate. Dr. Pan, Dr. Jayadevan, thank you very much for your time with us today. With that, it's a wrap on this episode of Easynomics. We'll be back. Until then, goodbye and a very Merry Christmas to all of you. Bye-bye.